Let's talk a little bit about the experience and the recovery and the results when you have a procedure. I'm going to talk in this video about both FUE and FUT recovery, as well as the experience, etc. So the great thing with the procedure is we do things, because we're a Joint Commission accredited facility, we can give you a little bit of sedation, a little bit of pain, IV intravenous pain anesthesia. So unlike other places where you feel the full weight of time, where it feels such a long day and the discomfort of the injection, we simply don't have those issues here. The patients feel much more comfortable. We have everything as far as we can in terms of safety provided for you, in terms of making sure you're safe during the procedure, hemodynamic monitoring, everything, cardiovascular monitoring during the entire procedure. So safety, comfort, reduction of anxiety is a huge thing. Now with FUT or strip procedure, you're a little bit deeper. It's almost like you've had a few cocktails. It's level 2 conscious sedation. So people always ask, what kind of anesthesia is that? So there are 4 levels of anesthesia. There is level 1, which is just an oral pill. That's what most people do. To me, that's not enough because it provides still a lot of anxiety, discomfort, and the weight of the day you feel. Level 2 is what we provide, where you're going to feel pretty groggy, you feel a little sedated, you barely can feel any discomfort during the procedure, and you don't feel the weight of time. Level 3 is twilight, where you're really, really deep. And level 4 is general anesthesia. I actually can offer all 4, and I do provide all 4 levels of anesthesia here. But for hair restoration, you don't need the deep anesthesia. It's only for the first few minutes during the anesthetic during the procedure that I give you the anesthesia. So for FUT, slightly deeper, you're sort of knocked out a little bit more, and I harvest, I close everything, I do the recipient sites, and at the end of that point, we're going to sit you up, and you're going to have lunch. In the afternoon, my staff are placing. With FUE, I do give you ongoing little bit more anesthesia because the harvesting takes longer. And so during the harvest, I may ask, how are you doing? You say, I'm a little more awake than I would like. My nurse comes in and gives you a little bit more comfort just to make that better, because it's a longer harvesting period of time. But I have to keep you not as deep as the FUT. It's just a little bit lighter, but I want to keep you steady throughout that period of time because of the longer harvesting time. So because you're lying flat down this way. So you're going to be a little lighter, but it's going to be maintained longer than FUT. Basically, by the end of that morning portion, again, you're going to have lunch, and then my staff are going to be placing the grafts by the afternoon. The big thing to understand is that I've got incredible staff in terms of the level of quality control when they place grafts. Hair curl, the insertion, the lack of traumatic insertion, how the grafts are placed are just second to none, and it's just a huge component to the whole thing. By the end of the procedure, when you're done with the day, at this point you can go home, but you're not able to drive, so you're going to have someone take you home. So you have to have a ride. You can't take an Uber. You cannot just go home. We need to have someone pick you up and take you home. At the end of the day, you go home, and then we'll review some instructions with you. The next morning, I'm going to see you. Whether it's FUE or FUT, I'm going to see you the next morning. Just make sure the grafts are intact, review all the instructions with you. You're going to get a formal time where you're going to have a pre-op time where you're going to meet with my staff and go through all of the instructions in great detail and meet with me again preoperatively. So this is not to be a replacement for that. It's just sort of a general overview. It's things that I talked about during my consultation, but it's great to hear this several times. So the recovery, people always ask, what is the recovery like? So from FUE, you're going to have the backside exposed. You're going to see little dots, little scabs, but by a week, that area is pretty much covered. With FUT, you're going to have hair covering over the area, so you shouldn't even see the incision lines, pretty well camouflaged. And those little stitches come out about 2 to 3 weeks after the procedure, pretty painlessly. In terms of pain, bruising, swelling, etc., pain-wise, a lot of people read, oh, FUT is so much more painful. It really isn't in my hands. I had a lady this morning I did yesterday. They had some discomfort, which is incredibly unusual, but I knew how to manage it. That was just some nerve irritation. I put 2 drops of Botox in, boom, pain is gone within 1 minute. So discomfort level with FUE, FUT, very comparable. There's not a lot of discomfort with either one, although you could have a little bit more with the FUT, but typically it's not bad. In terms of swelling, only about 15% of my patients have bizarre swelling around their eyes. That typically only lasts about 3 to 5 days, occasionally up to 7 days. I've had one patient 8 days, but again, 85% of my patients don't have a lot of swelling. Wearing sunglasses will cover that up. And The biggest issue in terms of recovery is you're going to have visible scabs. If you're totally bald and you can't cover the scabs, you've got to wear a hat. You can wear a hat with, pretty much when you leave, with some exceptions, which I don't want to get into because it's going to make this more complicated. But you can wear a cap to cover up the scabs, and the scabs develop over a few days to a week. And that's the biggest limitation when you're looking at something that may make you not be able to go in public. But again, a hat would cover that. And at 7 days, you can rub all the scabs away. In terms of the way that you feel, most patients feel pretty comfortable. I don't think they really can't go to work, but if you have that swelling for a few days or you have the scabs that you can't cover, clearly that's going to be compromising in terms of your social professional interactions. After 7 days, when the scabs are gone, for FUE, when the backside is grown in a little bit, where it's covering the backside, most patients are pretty good at 7 days. But if you have a high-profile job, I can't promise you someone doesn't see a little discoloration or a few grafts in that area. But most people have about a 7-day recovery time. You can shower after 24 hours for either procedure, light shower pressure, and what you're going to be doing is doing an ATP spray. That really helps the grafts grow. It's like CPR for the grafts. The next question people ask me is, when can I go back to working out? What kind of physical activity restraints will I have? So from exercise perspective, I'm okay after 10 days for you to 10 days for you to start listening to your body and start going back to a light workout regimen, but not to be pushing it too hard, because you may fall down, faint, and all those things. If you put a lot of pressure in, you may just feel exhausted. You may, fall, whatever it is. I want you to listen to your body. Slowly go back to that. Some of the restrictions, if I'm doing an FUT procedure, 6 weeks, no swimming, no dirty water exposure in terms of tub bathing, going underwater, or all that. If it's an FUE procedure, 3 weeks, you can go back into the swimming pool, do those kind of things. 3 to 4 weeks roughly. So there's maybe a 2 to 3 week difference between the two in terms of allowing you to go into dirty water exposure. In terms of traumatic sports like this, I would say probably 6 weeks for the FUE and probably 3 months for FUT in terms of karate and things like that. Just working out though, just listen to your body. Usually most of my patients start going back within a week or so after that. The next question people ask me is, when do these hairs grow in? Because we use PRP, A-cell, ATP, hyperthermosol, again, one clarification is that I use PRP with the surgery, not as a standalone by itself. I don't think PRP can grow hair well enough, but I think that PRP with all these other technologies really help grafts survive so much better, whether it's FUE or FUT. I've seen as early as 4 months growth, but most times it's starting to look good about 5 to 8 months. So it's a much faster window and much higher percentage of survival rate than other places. Partly it's due to obviously the technique of what we use, but also because of the regenerative medicines. So over time, that graft starts to become better and better, and over a period of 6 to 18 months, there's full expression of it. What are some limitations of surgery? Well, the biggest limitation I tell my patients is, I believe that if you look closely, you may always think, Dr. Lamb, could I have like a few more grafts here, here, here? And I always tell my patients there's always a chance you may need to have more grafts. But I'm very confident, and by using all these technologies that I do and the type of surgery that I do, that my patients get really consistent good growth. So the key with this video is talking specifically about the experience, the nature of the recovery, and the results and the timing of the results. So I hope this video helps you out.